Pediatric Lounge, a podcast taking you behind the door of the physician's lounge to get a deeper insight into just what docs are talking about today. From the clinically profound to the wonderfully routine and everything in between. Good morning, George. It's Tuesday morning again. How are you today?
How you doing, Herb? Yes, it is Tuesday, and today we have another great person that, he's like me. He's an MBA. Cool.
I
Um,
am, yeah.
Excellent. Today we're going to talk about, his name is Andy Johnson, MBA, and we're going to talk today about what is a GPO and why is it important for pediatric private practices to succeed. So let's take it
Andy,
away.
Andy's a seasoned executive in operations, finance, and healthcare. He's joining us today to talk about the importance of saving money and acquiring supplies and lean processes for success of pediatric practice. Welcome, Andy.
Hey, thank you guys. Hey, first of all, congratulations. Big milestone on your last podcast. So glad to be here.
Yeah.
Thank you. Andy, we always start with asking our guests, how has been your journey through pediatrics and pediatric management? Where did you start and why are you in this field?
Keep sucking me back in. So I actually got my degree in engineering as a mechanical engineer. Worked at Apple and Google and a couple other places back in the early 2000s. I've been doing stuff with pediatrics and primary care probably now for about 20 years. And I really got into it because both of my parents are pediatricians. And so I kind of grew up with it around the dinner time conversation, everything from the interesting conversations to the challenges that were being faced every day, probably from the late 70s through the 80s, the transition to managed care. And it just seemed like there was a lot of stuff that needed to happen and a lot of work that needed to do. And healthcare has been traditionally very slow to act when it comes to adopting technologies, um, and things like that. So that's kind of how I got sucked back in. I really, was chasing my childhood dream to become a firefighter and a paramedic out there. But at the end, I actually found myself working in pediatrics. So
it's in your blood.
It's in my blood, and it's hard to get away from.
Yeah.
I think you guys even talked about it on previous podcasts. It's becomes kind of a family business.
Yeah.
Those conversations that you guys have talked about before about should you encourage your child or ever to go to medical school. My parents were of the type that like, no, you're going to get so much debt. You're going to go do something with engineering or something like that. But I think at the end, it worked out great. So
Are your parents still practicing or?
Yes. So my mother retired. She was working with Kaiser for, oh my gosh, almost 35 years. And then my father has been practicing now for 46 years, I want to say, and is going to finally retire at the end of next month.
Wow.
So he is still seeing patients full time. It's actually been a very interesting journey watching him go from, I believe, doing spinal taps and having his own lab all the way to now having to deal with EHRs and the technology curve and all the other stuff, especially since running a pediatric practice has gotten exponentially more complicated over those years with all of the administration, dealing with insurance companies, the back and forth with all that. Plus, their main desire just to deliver the best care they could. So
Right.
Wow.
it's yeah. So that's a little bit of my story.
Interesting story.
Is your dad in a physician-owned practice or?
Yes, yeah. So he is in he works, and now I work for SF Bay Pediatrics, which has got 10 providers, 10 doctors. And they're in San Francisco. They have an office in San Francisco and then another office across the bridge, the Golden Gate Bridge in Mill Valley. And when he started, it was just 2 of them, and now it is up to 10.
Well, I never understand how you can run a practice in San Francisco or New York City or, the middle of LA. I mean, where the rent is, you're competing with, Ferragamo and Gucci and,
Yeah,
where the margins are 100%, a pair of shoes is 1,500, they make $700 off the sale. They only have
yeah.
to sell, 3 pair of shoes a day.
Yes,
Uh,
real estate is definitely at a premium, and it poses challenge. Like when you have employees, like how do you get break rooms? How do you fit everything in there? You kind of reach a capacity. And so the Mill Valley office has a little bit more space, but not really any way for us during COVID to say like pitch a tent and see people in the parking lot or anything like that, or really being able to divide up our office like we wanted to have sick patients enter and well patients enter in another place. So we did a lot of um, telehealth, and still doing a lot of telehealth, which I think is great. And also getting all gowned up, walking out, doing our tests, and turn around, come back, say, okay, you're negative, you can come in and stuff like that. So
Do you manage your dad's practice or?
I do half. There's actually another full-time practice administrator who was recently hired, is doing a great job. And because of the HR and all, we actually just transitioned our EHR too. So yeah, well, there's 2 of us out there. There's actually 2, and then we actually have a couple other remote employees, which is another thing we started doing, is actually hiring people remotely
Yeah.
to provide advice. So like our advice nurses don't have to be in the office anymore. Give them a computer and a Zoom, and they can answer the phone, and it works out really well. So
Well, that
what,
helps
why?
out real estate. It helps with real estate, so you don't need so
yeah,
much
yeah,
space.
and also employment's pretty high.
Yeah.
We can, sure, later we can talk about all the expenses and the practices out there, and vaccines obviously are a huge expense, but for us, we also have to deal with rents and
Right.
salaries.
So
So
why do you think you said pediatricians, but I would imagine it's all primary care doctors are slow to adopt technology?
uh geez, you did talk about this a little bit on previous podcasts. It's just the way that doctors who are trained to be very certain, and so there's not really that um, desire to adopt very fast. You want to make sure that it's correct, and so that that causes a little bit of a of a delay. So you can go to another industry and look at it and say like, oh yeah, they're gonna go. What was my example? 7-Eleven and Frito-Lay's Doritos. Like, you buy some Doritos at 7-Eleven, they know when and where that was manufactured. They have barcodes down to when it was delivered, whether it was on an end cap or anything like that. So the technology to know all these things really exists, but healthcare is not going to pick them up until they have certainty that it's going to make a positive outcome. There's just a lot of money involved, there's a lot of risk involved, and so since it's so heavily regulated, it just takes a long time for those operational and technology items to matriculate down to the practice, especially in private practice where there's the primary earners are also the administration. So the people doing all the work to earn the money, or majority of the work to earn the money,
Mhm.
have to sit in an administration role. And so that causes some delay in an adoption as well.
Yeah, I also think if it doesn't improve care, it doesn't improve margins, and it creates more work for me. I don't
Yeah.
see I don't see it as anything but a pain in my right. I mean,
But
no, no,
also, when you have those doctors on the administrative table, they can also push things forward faster.
sure. But some things don't need to be pushed, and I get in trouble by saying this all the time, but I
I
don't care.
know the paper charts are yesterday's news. They needed to
No,
be pushed. You need the
well,
EHR,
no,
you
no,
really
no.
do.
But no one put a gun to anyone's head to
Uh,
go buy an iPhone.
but
I
everybody
mean,
did.
people stood in lines, still stand in lines to fork over $1,400 for an iPhone. And the only way they could get American doctors to adopt EHR because it wasn't ready was to put a gun to their head and say, "We'll pay you less." Oh, by the way, but we'll pay you less. But by the way, we'll throw, I think it was $20 billion to California's IT industry to
Yeah,
build the EHR to be a cash register for you.
yeah.
And it won't cost you a dime, which wasn't true. That was kind of like you can keep your doctor if you want to. But anyhow,
Yeah, we're
but
going
they,
off target here. Why don't we do the
but,
That's
topic?
but,
right. I
Let's
mean,
talk about
they're all problems
but
we've been dealing with for a
But
long
really,
time.
right? So they didn't have to force anyone to buy an iPhone. So I think that's part of the problem. The solution is not something you want; it's forced upon you. It's harder to adopt.
Yeah,
Uh,
there was definitely a carrot and a stick. There were, depending on how much public care you gave, you could get some incentives to adopt an EHR. But on the other side, we were all stick with the high tech DAC and everything because at our practice we don't have much, Medicaid in our case, and so we got no incentives. We just got the stick like they had to do it. So
yeah, it's tough.
I think that's what happens a lot with primary care, especially pediatrics, is it's overlooked. And I actually like a lot of the ideas that you guys are coming up with because I think it needs a better spot at the table. Pediatrics it affects lives much longer than the specialists who are, generally running those conversations. So
Yeah. So, what's the biggest practice expense for a pediatric office today?
Depending on location, vaccines could definitely be one of the largest expenses out there. For us, it's rents and salaries and then vaccines in that way, and just on the expense side of it.
And so,
Yeah.
how can any pediatric practice um, manage the cost of their vaccines on the commercial
Sure.
side?
Well, I think the whole topic of this podcast is really around GPOs and what they do. They go by a lot of different names out there. So some people call them GPOs, some people call them physician buying groups, or maybe physician organizations. And they come in a lot of different flavors, but they are honestly the most cost-effective way to procure your vaccines. y- you know, uh, it's one of those things that just kind of happens in the background. It's not something that people are really aware of. I've been understanding and working in this particular marketplace for 20 years, and eh, it's just not something that people think about. However, it is crucial in order to deliver the highest quality care, and as you talked about earlier, some margins, which there was a long period in the late 80s and early 90s where people were giving vaccines because the the benefit to population health is overwhelming, but they were doing it at a loss and going out of business. So how do you get those costs down? And that's what a GPO does. So they can aggregate a large consumer base. In this case, it's mostly primary doctors, and get discount tiers from the manufacturer of those vaccines. So,
So
anyways,
a GPO is a group purchasing organization.
yes, yeah,
What
that's
what,
what
what
it's.
we mean by that, and it basically functions like a cooperative, where a group of consumers get together to have the buying power that they can't have alone.
Yeah, that is a nice simple answer. However, I think like most things, it's in the details, and how they do that is how different GPOs form. So some of them are more hospital based. So they'll go get, 2 or 3 hospitals together to get certain volumes on stuff. Whereas other GPOs out there are, I think the best term is a committed term, where they're saying like, okay, we're going to buy this product from you and not buy something else from somebody else in terms of a competitor, and then the cost gets reduced. So you are committing to a certain percentages of your purchases being purchased for those products. GPOs, group purchasing organizations, are not just in healthcare. They span hospitality, manufacturing, engineering, and they do have a specific designation within the IRS and in the United States, as well as from a federal level. So they are regulated. But in healthcare, particularly, they had to carve out and make a safe harbor section for GPOs in that realm to make sure and try to reduce healthcare costs by doing that. So everybody gets together. You can kind of choose one of it's a volume-based contract, negotiate that directly with a manufacturer, and then turn around and say like, hey, I've got a couple 100,000 people here that are going to be buying your product, and using those economies of scales, get the cost down to those.
And so,
GPOs.
yes, go ahead.
I was going to say GPOs are not like a distributor. They do not take and own the particular products that they are dealing with. So vaccines, they don't claim ownership of them. They just negotiate those contracts to lower the prices and hopefully pass on those prices to the people that are actually buying it.
So just to better understand, I would assume that maybe your practice in San Francisco does anywhere between $100,000 and $200,000 in vaccines per provider because you take no Medicaid.
Mm-hmm. Yeah,
and
that's a good estimate.
A single practitioner who takes 60% commercial will probably be around $100,000 a year in vaccine inventory.
Yeah.
Depends whether you have a young practice or an old practice. Some vaccines are more expensive than others. And the margins on what the industry calls the serum are very tight, 6 to 10%. That's the most you're going to squeeze out of that. And that is not only dependent on what you pay for the product, but also if someone makes 10 times an error in billing for your HPV vaccine, and you've now lost about $3,000 that you paid and never, it really came out of your pocket. You paid for that vaccine serum. You gave it. You can't on-give it. You can't call
You can't take it back now.
Bring the kid back. I'm going to take the vaccine out because I never got paid for it. And that's a real loss. I mean, that's not just a loss of my time. That's my pocket that picketed by $3,000.
That's correct.
So if we do the math, if you're buying $100,000, you're going to make 6,000. Somebody made a mistake 10 times 300. That's 3,000. Now your margin's down to $3,000 on a $100,000 investment. That doesn't include the carrying cost of
storage.
The loss of
disposal
opportunity for that capital, had that impacts your cash flow. So it's a real tight margin operation when it comes to the vaccine serum.
Yeah.
Now, one thing I always get kind of stuck on the GPOs is there's a price list that the CDC puts out. Right? Mm-hmm. For both Medicaid, or they don't call them Medicaid, they call it vaccines for children. Mm-hmm. And then there's a price for commercial that they put out. And then there's two things that I don't understand. One is the insurance companies barely ever pay you what the commercial list price is on the CDC website. They don't reimburse you at that. They use other price lists, which are significantly below. And how does the GPO get that discount for the practices when there's already a list price that's set by the government?
Most of the industry actually does use some people call it WAC, which is the wholesale acquisition cost,
Mhm.
which is, let's say you're a big distributor and you order train loads of this product, what they would be paying, which is where pricing and reimbursement supposedly gets set. And you know that nothing's as easy as it ever should be, where you see a price, you have like an MSRP, which is equivalent to that kind of WAC pricing. And what you get paid off of that is variable. It could be variable from one payer to the next. It could also be that same payer can pay you different amounts. And so we really look at the averages over that time. The CDC price list is just what the CDC itself negotiates, just as if they were their own GPO. So the government should technically be the lowest acquisition cost. There are ways around to get close to that price using a rebate structure, which hopefully, if you are participating in a GPO, should be paying you a rebate to lower the acquisition cost of those vaccines. It's a very important thing. You
What
have a
I
question?
found very confusing is
Yeah.
when you talk to different GPOs about vaccines, they all say, "Well, we all have kind of the same price because it's
Hmm.
regulated." And but why is there this variability in reimbursement?
Oh,
So I'm sorry, not
uh,
reimbursement and and acquisition
in,
cost.
in
Well,
acquisition cost or reimbursement?
well, if everybody buys it for $100, how can it be that physicians are not making money on vaccines? Some are, some are not.
Well, there's two parts of that equation, right? So
Yeah.
if you're going through a GPO, I don't think it's possible, but you can get a 10% discount on that $100. You're getting it at 90,
Hmm.
and so that's one side of the equation.
But they all get it at 90.
Um, no, everybody doesn't get it at 90. Some people are paying $100 because
Yeah.
they don't have any leverage.
No, but I
And
think all the GPOs have the same acquisition cost, right?
but they have different rebate structures. That's what he's alluding to.
Oh,
Yeah. So the out of if you are on a PBG GPO, which is typically a group of physicians, not a hospital-based ones. The hospital-based ones are, multi-billion market cap, publicly traded organizations that make a lot of money. And I don't like to use the term middleman, but that's what they do is they sit in between a large consumer population, which would be the hospitals that are buying everything from products that go into their surgical center to their, more pharmacological products. The stuff that's given in the non-acute setting is a little bit different. And that's where I would say the more physician buying group style GPO comes into play. So our office is going to use stuff that we can use in our a consumable product in our course of doing business during the day. So, we have the TB tests, we have the vaccines. Those types of purchasers are different than the type of purchasers that are buying stuff for hospital systems. So GPOs that are on the hospital systems are volume based. They say like, hey, we're going to buy this particular facility is going to buy $200 million worth of stuff over the course of the year. Whereas, as Herb was saying, like we're going to probably spend about $1 million on vaccines in our practice, probably a little bit more. And there's those two different types of contracts that GPOs are managing to reduce the cost. Everybody who's on the PBG side, the physicians, so the people that we would be working with, have or should have the same, I would say, contracted price. So from that contracted price, we can then have a couple discount structures that get you lower. So your invoice cost is going to be maybe 1 or 2% lower than that. So if we look at the scale, buying through a distributor is going to cost you the most amount of money for your product. As we step down, you can go direct to a manufacturer if they offer it, which would give you a little bit better cost savings because they're selling it to you direct. And then if you take that direct and you apply a GPO or a PBG contract to it, you're going to lower that because you're going to have to, either commit to a volume or you're going to commit to a market share on it. And by doing that, you have the lowest possible acquisition costs. And I know for 20 years of doing this in pediatrics, you kind of choose in this case right now, it's a pertussis backbone for your products, which then you kind of build a lot of your vaccine portfolio around. So once you've kind of discovered that, then you find the set of contracts that you like. Generally, we're talking manufacturer specific. Our practice uses Sanofi and Merck. And, that combination of those two manufacturers supplies all the vaccines that we're going to need. Right. I think there's going to be a lot of changes coming up. Some people like to use a Pfizer GSK, or you can use a GSK and Merck. So you find a set of contracts that will provide your portfolio, and that the cost then gets at the best possible way for you to acquire. The next step on top, and it should be the same no matter which PBG you're with. Now, as long as those PBGs are on those market share based contracts. If you're working with one of the larger ones, maybe you're part of a hospital system and you're affiliate and you get put onto, I can say like a Premier or a Vizient. There's been a big consolidation of those larger GPOs out. Their prices are actually going to be higher because they're volume based, and it's going to be on a per location basis. So you still get a discount compared to what you would be getting if you were getting it through, say, a distributor directly without a GPO. But that's the acquisition cost for us in those areas. Then lastly, on top of that, you would hopefully get some sort of rebate structure from your group purchasing organization that would then lower the cost even more. So those are the three factors on the expenditure side that you can look at from a GPO's perspective on how using those economies of scale can get that product from the manufacturer into your office and hopefully sitting in your refrigerator or freezer and getting ready to be used to be put in the arm or mouth of your patients.
And so what is a realistic expectation if you're buying vaccines? Just set $100 as a, let's say, I don't know, injectable polio vaccine, say it's $100 a pop, which is not, but just to make them.
Yeah.
What do you think? $3 to $5, 3 to 5% is about the most you're going to be able to lower that acquisition cost?
Oh no, you can get up to 46% discounts on some products if you factor in everything. I would say soup to nuts on that. So from the discount, the discounts extend more towards products where there is not a competitor. So almost everybody's making a hepatitis B product out there. So when you're dealing with these committed contracts, which we're mostly talking about, you promise to buy one manufacturer's hepatitis B maybe at a 6% discount. But then their sole source product that they have, you can get a 40% discount on because they have the margins to work with that. So we're really pushing hard to keep the costs down because we know that it is imperative for our margins because it takes so long for us to get paid on all these activities. But the discounts on the invoice are really just the start of that whole process. And it can, I'd have to go back and look at all the pricing that we pay through our GPO. But that's more or less what happens is when you have a competing product and you commit to buying that from one manufacturer, you get a discount on their sole source products, which can be quite substantial. I think HPV is a good example of that. So the contract discount on HPV, because there's not really a competitor for it out there, from Merck's perspective, you get a higher discount than you are on something there where there is competition out there. So
Okay. And if you weren't wearing the GPO hat, you were just, the managing the practice, would you do what business people say, get a quote every year for, from three different people to see which one is a better contract for you?
I do that for our practice. So um it's something that actually does take a lot of effort. So you just can't look at the acquisition cost, the expense. You have to also look at the reimbursement. Um, so you guys, Dr. Rogo, you did ask like, why is the reimbursement so different? You can find that from one manufacturer to another manufacturer, the reimbursement for the same, say, hepatitis product is different. The different CPT code pays, yeah, it's shocking. So, um, and actually also too, if you're a little bit more in the adult space and maybe do not vaccinate as much, your contracts may not specify, the the appropriate reimbursement amount on there. So it's pretty imperative to take the time and look at that portfolio of all of the vaccines that you're giving, from the acquisition cost, from buying them, from and to storing them, to disposing of them, to what you're getting paid for them, to make sure that that margin is acceptable. There were times where we did analysis and we're like, oh yes, we're going to save $40,000 by switching to this particular line or the other particular line, just to find out that we'd lose about $80,000 in reimbursements. So we would have saved 40 on one side, but lost 80. So we would have netted out a negative 40 on that whole process. So it is a chore to do that,
I'm
but
gonna pick your brain on.
Don't, but hold on one second. Don't the vaccine manufacturers know this?
they do.
So why do they do that? It sounds like
I have not. That is one of those
hustling
great
people.
one of those great mysteries that I've never quite understood.
I mean, how can somebody in good conscience go to Dr. Bravo and say, okay, if you change to my vaccine, Dr. Rogu Special will give you 50% discount on buying it, but I know that your insurance company contracts will not reimburse for it.
They don't know
Mhm.
that.
He says he does. They do.
No, he knows that,
Uh,
but they don't know that.
the doctors don't. It's an information disparity for sure.
Andy knows that, but Merck might not know that.
Yeah.
It's the same thing. My dad and my sister are lawyers. Okay. And I mean, I love them. They're good people, but a lawyer only takes a piece of every transaction they touch. And they really are not concerned about why they're taking a piece. That's what they do for a living. You want me to write you a will? Is this much? But if you don't do that and you die at probate, it's going to cost your estate a lot more. And that's it. I mean, and this is business. People are like, we'll give you this. We want to sell it. We don't care if you make money or not. That's your problem.
Hmm.
So
I think like that's why kind of shedding the light and why asking what a GPO does is, we look at those things and like I said, it sits in the background. It's like something you guys as doctors kind of want to think about, but don't have the time to. There's just no more bandwidth. And so finding and shedding light and on that is really important for, everybody's sanity a little bit, but also for delivering that highest quality care. It's like a complicated, you have to have very specific industry knowledge of what are the products out there, who makes what, how does it compete,
Right.
what is the matrix of every vaccine that we're buying, how does that schedule work, getting people in, making sure we're getting reimbursed for them. It's a huge HEDIS measure too, so it's a big part of our practices, and it can.
You know what confuses me still? Because I do a lot of the contract negotiations, right? I
Mhm.
think everybody focuses on let me buy the vaccines for a cheaper price so I can bill out an insurance company. I think the problem lays in the insurance contracts with the individual physician groups.
Yeah.
because like for CPT codes for office visits, it's very simple. It's a percentage above or below Medicare of
Medicaid,
a
yeah,
particular year. With the
ERS.
vaccines, it's average wholesale price, Red Book, this, the other one that you said, the WAC, the CDC price. Sometimes I've seen one company where we'll pay 120% above what Mr. Insurance Carrier's rate is. There
Yeah,
has to be a centralized number.
There's not.
there's not.
So it's like five
So,
moving
so,
targets.
so look,
There is.
So
in
which
a
is the
re-
best one when you do an insurance negotiation? You should have a percentage above what?
no, he just told you. You have to look at each contract versus what vaccines you get
Right.
and see what your margins are, and then you have to make a decision.
No, 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 no. It's the wrong. But you have to go at the beginning, at the contract level. So when you're negotiating a contract, like I'm doing one right now,
But
I want to know vaccine should be paid as a percentage above what? Because there's no Medicare value for vaccines.
mm,
It has to be a value of something.
But George, you're going to sign a contract for 3 years with a three yearly escalation,
Uh-huh.
and you have no idea what the vaccine market's going to do next year. So I just say that you're paying $100 for the IPV, which is 150% of what the CDC list price is.
Well, that's it. They don't
And,
use the list.
and
The
next
CDC
year,
price.
next year, the IPV goes to 175, and now you're losing $25 on every IPV.
Well, that
yeah,
has happened.
because
So,
you
but
don't because you don't control both sides. But essentially, what is wrong with this market is it is not a market like any other retail market. So if I'm Sony or I'm Apple, Apple doesn't do this, but Sony did, and I'm going to sell a TV. I send it to Best Buy and I go, you're going to buy it for $500, but your list price has to be $750.
right,
You have,
yeah,
it's usually $1,000 and retail's 100% markup because that people say that, oh, that's outrageous. No, they got to pay rent, they got to pay employees, they got to hold that inventory until it gets sold, they got to collect the money from the customer. But that doesn't happen in vaccines. If the vaccine market was transparent and functioning, the CDC would come out with a wholesale list price, and every insurance in the country would have to pay twice as much for that vaccine. End of discussion. And then it would be profitable for physicians to give vaccines.
yeah.
But that's how it works. It's the mess. So how do you calculate? Do you have a calculator?
Every other country in the world except for the United States and maybe one other one has a governmental body that does that. We don't have one here in the United States.
So how do you calculate this? Do you have a calculator? You throw all the numbers into it?
Well, yeah,
Or your
wait, yeah. So we try to do it on an annual basis where we can look back at the year and look at the margins for each of the CPT codes for the vaccines that we're giving. Jump into your favorite practice management system. Hopefully you can get some reports on that. And George, even as you were saying, like you expect to be paid on a contract something. We're not looking at every individual transaction. And I know because there's averages and we get the statistical, we don't get paid the same for everybody on
right.
those contracts. So we just have to look at an average and make sure that we're number one, not losing. And then how do we maximize those margins? And in terms of like conversations with the manufacturers are like, well, if you can get reimbursed more, if we can get the cost down, getting more vaccines into arms works out well for everybody across the board. Works out clinically, works out financially, the manufacturers sell more things, and then population wise, we have a healthier population. Our patients are better. So it is definitely one of those frustrating things that we have to go through all this effort to do something that's so positive. But that's what we have to do. We literally have to make sure that our contracts, and because it is such a big expense, not only that, but we were doing a lot of HMO, and the HMO would have like some staff members that were our doctors that would come in like, hey, can we look at what pricing you guys are paying for these, because they wanted to vary the pricing that they were reimbursing us for those products, which is something nobody should do. Like if somebody who pays you money wants to know what you pay for something, do not tell them. Do not give that information to them, and they have no right. And there's actually laws that say they have to adequately reimburse for that. Actually, I think the CDC website or the AAP has a vaccine guide on how to make sure that those are and maybe I can find that for you guys in a little bit
Yep.
to make sure you're adequately reimbursed for those things.
So you look at this once a year, and then you look at different GPOs for your practice
Yeah,
and the contracts, and then you try to balance what's best. You might
yeah,
take a dollar loss in one vaccine, but you're making $50 in another one that ends up making you a bigger
yeah.
one.
And definitely the doctors that are managing the practice might choose one product that might cost more, smaller margins, but has some other benefits to it. I think the meningococcal B vaccines, there's the we recently, maybe about a year and a half ago, switched from the Pfizer product over to the GSK product because it is a series of vaccines and the window to deliver that was smaller with a GSK product. So, but it cost a little bit more. And so the margins went down a little bit, but they figured it would be better to get the vaccine series completion done in a shorter window. So there are other value propositions besides just the dollar amount. And it'll also be interesting too. I think in the vaccine space, we're going to see a lot of changes in the next year. So even those GPO contracts should be hopefully brought to the front of mind. Number one, the COVID vaccine is going to be coming out and no longer supplied by the governments or counties or however people are getting it nowadays. So that would be one aspect to it. And those contracts that you're on are going to probably start including those if you guys are on GPO contracts. The other big one that's going to be coming around is the RSV vaccines that are coming out. I want to say there's 5 or 6 of them in the pipeline. One of them is one of them has already been approved for the older 60 plus population, but those will be definitely coming down into the pediatric office soon, and they'll also kind of factor into those. So there'll be some changes in the portfolio, changes in the vaccine schedule with RSV coming down. So I
That's
think there'll
going
be
to be
some.
a game changer. The RSV vaccine is going to be a
Mhm.
game changer.
Yeah, yeah,
Um,
yeah,
and the pneumococcal vaccine is also changing, right? From
yeah.
the
Those.
number, that's going to be very confusing. I don't understand the nuances of that, but the number of pneumococcal antigens in the
Yeah.
vaccine will change.
Yep, going from 13 to 15 to 20 to 23 to
Yeah. Yeah, with the pneumococcal vaccine, I get hustled by both departments. I won't mention their names, but you guys know who they are. So I get the new boy that comes up. If you flip to our pneumococcal vaccine, we'll give you they're going to attach it to a discount to the other heavy duty
hmm
vaccine, the one that prevents cancer. Um, Now, the other guys that you've been using for the pneumococcal disease, rather than being smart and giving a dramatic discount to their vaccines, they don't do that. They're just going to give you a little bit of a discount, which will be just a little bit less than what the other guys are going to do. They're going to attach it to our big vaccines. It's
Yeah,
like, I just give them a hard time. I said, you guys, you want us to use the vaccines? Drop the price. But
yeah.
I don't know. It goes on deaf ears. These are just the sales reps.
Right.
Yeah, and there's always the non-inferiority. There's I don't know if you guys remember the old movie Something About Mary when the guy's like talk. I got this great idea for this new workout. I'm gonna call it like 8-minute abs, and you're gonna get a great ab workout in 8 minutes. And then, well, what happens if somebody comes out with 7-minute abs? And that's kind of seeing what we're what we're seeing here is they are proving efficacy. I get to look and watch a lot of those medical directors present. Does the extra antigens help prevent? I would say the most dramatic increase has already happened, but there are some subsets of the population that would benefit from more antigens, and it just keeps on going up and up and up and up.
Yeah.
So It will be interesting to see how it all plays out. Um, but yeah, like I said, we are the only country here in the United States that really doesn't have a governmental body that does what GPOs do. So GPOs, the function in every other country is done by the government in terms of saying this is how much it's going to cost, this is how much you're going to get reimbursed for it. But hopefully your GPO is fighting for you on that situation to increase those margins and also make you most aware of what what's coming down the pipeline. How is it going to affect your workflow? Understanding switching costs, and then hopefully looking at reimbursement as well. Either giving you the tools or the GPO that we work with actually helps us do that analysis. So,
But
So
GPOs are not limited just to vaccines. You got everything there.
yeah,
Tests.
yeah.
but not
That's the
every GPO does that. So I mean,
no.
some do, some don't. It depends on how they're structured.
Yes, they, like I said, they do come in a whole bunch of different flavors. Some of them can give you procurement systems, and some of them can, do office supplies, medical supplies, other services out there. I know the one we're with does have contracts with developmental screening, also vision screening. So, from our perspective, you want to be aligned with a GPO that has, um, making your practice run easier. I mean, the more you can dedicate towards spending time with your patients and not having to do the back end and understanding of all the nuances of these contracts and these arrangements, then you can spend more time with your patients, which is ultimately what I think we want to do in our practice.
Yeah.
So,
Can you tell us what GPO you're with?
So I have, before you go there, I got a
oh,
bunch of questions.
All right.
okay.
So one, I'm fascinated. How do you do this calculation? Do you give the GPO a set of codes and then they run it for you? How's the mechanics of that? Or you
So,
run it in
well,
house and then tell the
yeah,
GPO?
you guys are very familiar with PCC because I know Chip's been on here. Chip and I
Yep.
have been
Yes.
friends for 25 years. And so our practice management system was run through PCC. We go pull the report off of our CPT codes, which gives us an average of what we're getting reimbursed for those CPT codes. Those correlate directly, usually to, what a Pentacell is, which we're using is 90698, I think. I'm just
Okay.
pulling that out of somewhere. And just look at how the margins run on that. So from our cost, and we build in a little bit for our storage, and we try to minimize our inventory. So that means we're not storing too much. Also helps the cash flows. So try to seasonally adjust our inventory levels, and then compare it to what we're getting reimbursed just for the product alone. So we're not talking the administration stuff on there. And then we look at the additional administration levels on that one. So I mean, we have an Excel spreadsheet, or actually it's a Google sheet that does that, and that's how we compare it. What the GPO would do is you would have to supply those average reimbursements per payer that you have. So I want to say we take our top 7 payers in our practice and do that across the board to see how the margins work out, and then we review it on an annual basis. And just to make sure that we're not losing money on it, but also to evaluate what the GPOs out there. And I mean,
So Chip and I disagree on this one because
okay.
We run it through Tableau, and I can tell you what RBK Pediatrics makes or loses in any quarter on any vaccine. Just everything is out in a dashboard. But I don't use the vaccine administration fee because I think I'm first comparing, are you making money or losing money in the product? Then every factor that you said, right? I mean, you may be losing a couple of bucks, but it's the right thing to do for the patient. And, then the vaccine administration is a whole other revenue center,
Okay.
which is harder to figure out whether you're making money or not. I mean, somebody's giving you whatever, 25, 30, 40 bucks to administer a vaccine. How much time's involved? I mean, who has time to actually go measure how much staff time is, what the syringe cost, what the needle cost,
Well, they actually did that study at one point. That's where they came up with
Yeah.
the Medicare
Yeah.
value.
So, but I
And
look
then
at just as the whole thing, not the average, because you'd be surprised how, not in a large practice like yours or George's, but in a smaller practice, it really does take 5 or 10 missed reimbursements to wipe out your margins, especially if it's the HPV or
Yeah.
yeah,
pneumococcal.
Prevnar.
Yeah,
Yeah,
they're very expensive,
yeah, incredibly.
so I like to know that to try to get the billing department to go chase after that. Basically, because I'm offended. I really do feel that they're picking my pocket, and that makes me upset. So that's how we look at it. But Chip says you should always put the vaccine administration fees there as part of your margins. Um,
Yeah.
I think you can separate them out and then look
What's
at
the
them.
second margin? I mean,
Yeah, look them together and look at, are you
yeah, how
doing
much is from
good, and is
serum
it
and how much is from
convenient for the
that?
patients, and are you comfortable using that product? Um,
Yeah.
Now, you wear a lot of hats.
I do.
You manage a big group in 2 offices, and then you work with the GPO. So how would people reach you if they wanted to?
So I actually don't work for the GPO.
Okay.
The the we have I get to put my other hat on. So Practice Well is a large community of healthcare providers, which is where I'm at. I have conversations like this. I talk to people. Um, we do happen to have a GPO attached to Practice Well. It's called PVG, and we did that for a variety of reasons. So it started out actually as a GPO. It was actually called Pediatric Federation, that started 25, 27 years ago. It was probably one of the first organizations to take the GPO model and apply it to vaccines. But that Pediatric Federation organization, which was started by about 40 physicians in the San Francisco Bay Area, all pediatricians, in the I would say probably 80s. That organization was really formed to help pediatricians just deal with managed care and deal with the ideas that the healthcare industry was changing, and just how do we practice better. One of the things that came out of that was probably one of the first vaccine GPOs in the country. Over the last 20 years, those two, because of regulations and because of the desire to provide both the community aspect and the education aspect and the support, kind of split the two, one into the GPO PVG and then one into the community. So I'm more on the Practice Well side. We do have people that are hyper focused on contracting with vaccines and reimbursement and having constant conversations with the manufacturers about what's going on. So that's the group that I'm most familiar with, and I would say one of the key things about the Practice Well organization as well as PVG is they don't have any profit. It's been very physician focused. It was made by physicians for people just like you. And it's processed because it doesn't need to make any money. It gives back very massive amounts of rebates. So we're all in this together. We all are in the trenches. Here in the tech world, they used to call it eat your own dog food. I prefer to drink your own champagne. But the problems that you guys are, the problems that you are experiencing is the same problems that we have all over the country as people who work in practices. And so having a GPO that can negotiate and kind of fight for us on our behalf for lowering pricing, helping our margins, allowing the doctors to have the choice between saying like, look, I might spend a little bit more on this, but it's the product I want to use. And getting people set up so that they can provide the best amount of care is really the goal of all of those organizations.
Does
All right. So
Practice
let,
Well
So,
have like a dashboard that shows physicians you're saving by using this product, you're getting this much? Because I know with a lot of GPOs and stuff, they just send you a check at the end of the year and say, "Hey, you
mhm,
saved here's $5,000 for your troubles."
sure.
You don't know
Yeah,
what
I
it's
mean,
from. You don't know where it's from.
we do get statements, and we do provide statements. So from the practice side, every time rebates are accrued and earned, actually we just go to the Practice Wealth website. We have our bank account in there, and they deposit it, and then a statement comes saying like, hey, this is what you spent on your products and services through this GPO, broken down. It's actually part of the requirements of the law, so hopefully everybody should be getting those. And
so
in
so
terms of savings, it's actually very difficult because, as I think Herb was saying, the reimbursements in the San Francisco Bay Area are going to be much higher because of our fixed costs in there. Our employment costs are higher, our rent costs are higher. So, based off of our value units, we're going to be a little bit higher. I do love the fact that you're using Tableau. Full disclosure, my wife does work for Salesforce, and Tableau is a Salesforce product, but I
Yes.
do like that you have gone so far and plugged in your values. And I mean, if you got a good solution, I would love to extrapolate that across to, the 20, 30,000 physicians that are part of Practice Well and PVG right now. So I agree. Like, I'm all about putting more information out there at the fingertips. I think I've heard it a couple of times. Data is king,
Oh
helps
yeah.
make decision. Um,
but
and yeah,
to George's point, and we're getting a little far away from what I want to
okay.
ask. But to George's point is, and your point, um, there's too many thoughts. But first of all, I'm going to start with we need to learn from other industries. So in every other industry, there are coaches that keep you accountable and drive change through your organization. It doesn't matter if you're CEO of a 500 company, they got coaches. You're a real estate broker, they got coaches. You're a wife of a doctor that plays at the country club tennis, they got coaches. Because it does, someone else watching you hit the tennis ball gives them another perspective, and they can change your behavior so you're more successful. When and I love Chip Hart. I think he's one of the most phenomenally intelligent people in our industry. But he's a data nerd,
Yep.
Yeah,
and he
I concur.
dumps reams of spreadsheets. And I'm pretty good with spreadsheets, but I get a headache. And the busy physician managing a practice needs Tableau because they need to visualize that data quickly. They can't be going through a bunch of data in spreadsheets. Their mind doesn't work like that. They're tired at the end of the day. They're not Chip Hart.
Yeah.
It's a different skill set, right? I don't think Chip could see an ear infection, but we all have our talents.
Yeah.
So if it's not visualized, the data is not visualized, which is what you were saying. If you can't drive the data to the person that needs to put together the quality, what's best for the community, what's best for the practice quickly, make a decision. It's trash.
It,
And
it,
that's where
I,
where we
I
that's where
agree.
the disconnect is. So we have built this dashboard. I don't think it's ready for prime time, but anytime you want a Zoom call with us, I'll show you what we've done.
Yeah, it's
Um,
probably the complication of doing that across multiple different types of practices is like the standardization. So if
Yeah.
somebody's on PCC, they get one set of reports. If somebody's on OP,
you're talking
yeah,
like a pediatrician. That is not true. Not in Tableau, because
Yeah.
as long as you give me the spreadsheet for your AR for your practice in the same columns as all the other practices give it to me, I can upload it in less than 30 seconds.
Yep. You get pretty
Okay.
pictures.
If you give me your CPT codes with the reimbursement, the provider, the diagnosis, and the columns have to be exactly the same. But beyond that, it's just a dump into a file folder, and the numbers pop up.
Yep.
But what I wanted to ask more is, I'm all confused about Practice Well. Practice Well is a community, right?
Sure.
And so you work with Practice Well to help the community of independent pediatricians. And they do aggregation more than just the vaccine. So if someone wanted to reach out to you at Practice Well, where would they find you?
Practicewell.org is probably the best place to find us. We have our phone on there too, or you can just email me. I have an Andrew at PracticeWell, another person I work with, Joey, who is also steeped in pediatrics. Joey at PracticeWell, and together we've been doing this for, I think he's been doing it for almost 10, 15 years as well. So those are probably the two main contacts. And then if you have questions about anything, it doesn't necessarily need to be about vaccines. We've probably heard it. And there's.
And is there a cost to joining the community?
Oh no, definitely not.
Okay, so I just go in there, put my name, my email, and I'm part of the community, and
exactly.
I can reach out to people in the community. Okay.
You can reach out. Actually, most people go to our website to kind of explore all the benefits of membership. We have call them cards up there that say, oh, hey, I'm interested in compliance. I got to figure out how to organize my employee handbook. We'll have some resources or some people to do it. There are organizations out there that do that. Or I would say most people are coming in to figure out about vaccines, what to use, because that is such a cost and always on the top of people's minds. But yeah,
so if I wanted to join this
practicewell.org.
community, I just go to practicewell.org, not .org.
You can go to .com, but it'll rotate you over to
okay, because it's a not-for-profit entity, so it's a .org. Okay.
Yeah.
And then if I wanted to figure out, by the end of the fiscal year, what the GPO could do for their vaccines, where would I go for that?
Just give us a call, actually, is what most people do. Or you can, reach out to us through our chat. And it really depends on how you're practicing.
At Practice Well, I would go.
At Practice Well, yeah.
So I just go one place for both.
Mm-hmm.
And I would say, I want to know what, I could do with you guys.
Mm-hmm.
And then someone would reach out and ask for my CPT analysis to see where we're at. Okay.
Yeah, I think I think Kathy would be the one that was doing it, and she'd be, if you guys do need help with that, she has some spreadsheets that she can send you over that you can plug in and do your own analysis, or if you want to just supply us with an output of your practice management systems reports, then we'll go ahead and plug that in for you.
Yeah.
And that again is a free consultation.
Yeah.
So I give you my data and you say, we could save you money, or we can't save you money.
Yeah.
And
I've never seen it not save money.
And then there's also a differentiator, right? Which is relationships. Practice Well's GPO might be able to save me $1,000 a year, but I've been doing business with Joe for 10 years, and the relationship is worth $1,000. So sometimes service and relationships will make a difference if the difference in savings is not phenomenal, right?
Well, I don't think you would need to end your relationship with Joe. It's not like you have a different method of procuring whatever you are procuring. So you'd still work with Joe. So if Joe was your Merck rep, or I don't know, your
just say this as a competitor GPO.
Oh, another GPO. Yeah, if you have a good relationship. Honestly, to us, the most important thing is that you are on a GPO.
Okay.
Because we want you guys to succeed. We need everybody to practice the best medicine they can. And being on a GPO, even if it's not the most optimized, is the best start. I mean, I
Right.
still talk to practices across the country out there that are way overpaying for vaccines and other services by not being on a GPO. Or perhaps their rep from a distributor puts them on a GPO, but not the right one because they've been incentivized in a different way.
Right.
So that is a very quick low-hanging fruit that you can change around. The the GPOs out there, the big ones that are available on the physician buying group side, is fairly close. However, it's all going to boil down to that rebate, and everybody's going to have to pay for people and pay for things and pay for their stakeholders, shareholders, private equity, whoever's banking all of that. So that's why I think we have a little bit of an advantage within Practice Well, is that any funds that are unused go back to the provider or whoever bought those particular products and services in the form of a rebate, which you can use. So
Now,
And
what
to
if,
help.
hold on, Herb, what if somebody already uses a product or a service that's on Practice Well, and then they sign up with Practice Well? Do they automatically get a discount, or
Hmm.
they
Yeah,
do?
yeah, a discount. And I would say on the Practice Well platform, if we're looking through all of the benefits that are offered on there,
Hmm.
almost all of them earn rebates. I would
Right.
say there's two or three categories of benefits on the Practice Well platform that can't due to legalities, and those are usually around the HR benefit benefits. So like your health insurance for your employees can't earn rebates. It's an illegal thing that was established by the insurance commissions of each state. So,
Yeah.
but everything else earns rebates, and I would say new benefits are being added onto that platform across of them. Some of them GPO style, some of them I know that they're working on other products and services out there that are geared specifically for the healthcare professional. So it's not just for your practice, it's also for the people that work at your practice. So
and
your receptionist to your MAs to your advice nurse can also benefit from being Practice Well members. So I think those are going to be launched here in the next couple months.
and is there a point where someone is a practice, if it's small practice, is better served by a company like Canet that buys your vaccines, negotiates a price,
Um,
and you don't have to manage the cash flow.
it from the analysis that we've done as a practice, that I've done as a practice, you lose a lot of the margin, and it's already pretty thin. So they would have to be doing a lot of services to make up for that.
So I'm just going to interrupt you for a second.
Yep.
Canet doesn't take the admin fee. They just
Okay.
take, they just want to function like a humongous GPO and take that management hassle out of your hands. Um, and then when I'm thinking about this, I'm thinking about the solo practitioners. There's still some solo practitioners out
Mm-hmm.
there that are 70% Medicaid, which means that they're buying such a small amount of vaccines that there's really very little margin for them. It's just the headache of contracting and doing it all. And if they can focus that time on something else and make their practice better and their
Yes.
treatment better,
I
if you're losing $3,000 a year and someone else is managing my $50,000 in vaccine inventory,
mhm.
take it.
For
that I
sure.
mean,
I do see that. I see that happening in a couple situations. So in the more of the concierge scene where insurance billing may not be an option, as well as possibly where you wouldn't use an entire box of a particular vaccine. So, and you have to buy a box of 10 because they only sell them in a box of 10, but you only give, six over the course of the
yeah.
year. So those situations, I think, are great situations for that. But I'm not personally very familiar with that. I've gone from 2 to 10 doctors, and I think that's kind
And
of the sweet
I
spot
know.
that we're
So
seeing.
I think when you're 5, 10, 20, 30 providers, it's
Yeah.
worth your time to manage this. But when you're a small practice and 75, 80% is Medicaid, you're making very little out of that
Yeah.
vaccine. And it's distracting. It's just one more thing you have to deal with. It's
Yeah.
to your point earlier. Um, for physicians to lead their organizations, the data has to be clear and quick so they can go back into the exam room and do what they want to do, which is take care of kids.
Yep.
Correct.
Yeah.
Right. That's
Our,
the end.
our unofficial motto at Practice Well is being able to walk into your practice and practice medicine. That's the goal that this whole group was formed around. And it's getting harder and harder to do that every month, every year. There's geographic issues. Like I know at our practice, we tend to train our staff really well, and then they go and get taken away by people who can pay them a lot more money because they are Stanford or some other large hospital system. So
Everybody has that problem. And that problem's been around for 15 years or 20 years.
you know,
And unfortunately, when the economy tanks, it's great for the medical practice because you got really smart college age students who can't find jobs and they're show up on time, they're eager to work.
mhm,
Um, and when the economy heats up and unemployment's low, it's tremendously hard to find entry level people to run your business. And we are a people business. Both
yep.
we take care of people and we employ people to take care of people. So it makes it very difficult. What else do you want to share with our audience that I haven't asked you? I could talk to you for another
Ah,
couple of hours.
yeah. Well, first of all, thank you guys for all that you do. And I do have a deep respect for all of the pediatricians and really looking at the sacrifice that goes on to deliver the care. So that's one thing that I appreciate and I've definitely come to appreciate over the last 10, 20 years is just how much effort goes into providing it and how much sacrifice goes on. So first of all, thank you for doing that. The other stuff is just, I feel like these problems are solvable. And I think you guys see that too. It's just how do we come up with those solutions and get them out there so people can remain independent, can have the life that they dreamed about when they were going through medical school, getting more people into primary care and pediatrics and I that those are my goals, I think, in the situation, and I think that's kind of what we represent from both our practice, from the efforts that we're putting forth at Practice Well and PVG,
Mhm.
is really that's the focus. How do we keep our population healthy? How do we move forward with this to the best of our ability?
Well,
So
I think the problem with primary care and pediatrics, especially, is because I have medical students from NYIT. Nobody wants to go. They're told not to go into private practice. Private practice is a thing of yesterday. Go and work for the man at the hospital. I think there's not enough good stories out there, and that's what made this Pediatric Lounge podcast. What made this go become. We have to share these good stories, and we have to share and show them how it should be done. And we have to, I guess, like an apprentice, you need apprentices to learn
hmm
trade. And
yep.
Herb is trying to do that with his coaching classes.
It's but it has become a lot more. So I feel it's gotten a lot easier to manage a practice
Oh, definitely.
because automation has helped, and now I can get the reports I need to see where things are headed.
Hmm.
Um, I was telling, I can't remember who we were talking to, that I used Metasoft back in 2000, and it could only print reports. There was no comma delineated reports coming out of my billing system. So then you had to type it into a spreadsheet to run the numbers to calculate, your days in AR. And it was it just, you wanted to pull your hair out. I'm like, well, how's this possible that I can't get a spreadsheet out of my billing software? But you couldn't.
Yeah.
At least
Yeah.
today we get reports and we can run numbers and we can see the gaps and then we can make it different.
Now you have information overload.
Oh,
Yeah.
that is true. This has been wonderful.
Yeah.
Your dad has done a great job raising a great man.
Oh, thank you.
And
I'll tell him. He'll be watching this one whenever it comes out.
Yeah, it's
Hopefully
gonna
in the
come
next
out
couple
quick.
days.
We like
Yeah.
it. We'll make it come out quick.
I'll do my best to get it out soon.
All
And
right,
thank you
cool.
for your
Well,
time. And anytime you want, we'll show you the dashboard. Just let me know.
Yeah, I'm very interested, and I probably know 3 or 4 more people that would love to figure it out, and like I said, make this product available or make the template available. Get it out there so people can start making those good decisions. And
All right, just give me a time and I'll show it to you. Thank you for listening. This has been a production of the Pediatric Lounge. On the show notes, you will find links to our co-host and other important notes, as well as a timetable of the topics discussed today. Don't forget to follow us on social media and subscribe to wherever you listen to your podcast. Leave us a great review as it helps us greatly. In the meantime, we will see you next week. The Pediatric Lounge. The conversations are not intended as medical advice, and the opinions expressed are solely those of the host and the guest.